I'm very happy to inaugurate this data entry by switching on the computer. And
we have about 9 that have not been installed that we shall finish our
The facility has about 500 clients. So I'm thinking the number is manageable.
so each client has a number
Each
and
client
can
has a
be
number.
tracked to avoid duplications.
Exactly.
Okay.
When we have a unique identifier, then the person can be tracked by their unique identifier.
Yes.
And even if they move from one facility to another, for example, if they use a thumbprint, if they put your thumbprint here, then your entire record should come. The entire history.
That's the next phase.
We are using a thumbprint coupled with
that is here in Kabarole. If I go to Kasese,
currently that is the challenge. We have it is only in Kabarole within the district.
okay.
Of course, the challenges of communities being dynamic are really yeah, but we shall see how far we move with the district because there are, of course, movements within the district. And if we are able to capture those, I think that can inform the program to scale it up.
For this is a section,
No, we are still in use.
Yes.
Yeah, but other
Do you have a
20
printer?
health centers
You can easily
are
print.
ready. All their documents are.
You can export data to Excel.
you can export to Excel. So this
You
is
can export to Excel and print.
this is a quarterly report, 106.
Children, number of children, number of children, cumulative number of clients, number of new patients, pregnant and lactating number of.
So
So we are adding a category of 15 to 18.
Okay.
Then we have to
10.
capture them.
Yeah.
That's good. Okay, that's good. Thanks a lot for this demonstration. We hope you share these reports with the district, with everybody, DHO, and then of course to help programming.
Kabarole is going to be the model to implement electronic medical records. And we are going to excel again. To excel on electronic medical records, we must look at coverage because how do we link facilities that are not connected on internet, that actually have power? We are here to witness, to support us with 10 solar systems. And these solar systems were supposed to provide power to the computers and also provide light, because for us we are going to benefit here and there. We have the solar systems, we have installed one at Kichwamba, and what do we hope to gain as a department in this? Now, when you look at the average number of people in care per facility, it is not less than 500. Let's talk about 500. But some facilities go as high as 1,000. Now, can you imagine looking for a patient number 2,000 by turning pages? By turning pages, you're on patient number 1, you're looking for patient number 20,000. And we are so grateful for METS. We are going, first of all, to benefit by putting all the records on the computer, so that you basically need a space for the computer instead of needing a space for the files. We shall be able to generate even HMIS reports, monthly reports and quarterly reports from the system. Now, METS has concretized the skill. They have done a number of trainings with us. They have come to do some mentorship, and this is basically district-led. We are working closely.
With this program for HIV case reporting, we shall be adding evidence to already other systems that we have. For example, the serial behavioral surveys, the size estimation studies of risk groups, and the sentinel surveillance to form a more complete picture of the status of HIV epidemic in the country and the region. Now, when we get this data, of course, it will help us in planning and prioritization of HIV prevention and intervention activities. mainly aimed to identify persons with undiagnosed HIV infection and then link them to medical care and prevention services. METS will provide the technical support for clinics to be linked through a network biomedical patient management system, that is the fingerprint technology, as well as the use of the national identification number. Basically, what we shall do with this program is have a unique identifier, and I think our guest of honor, you went through the demonstration of how the system works, and it will enable us to track cases and referrals within and across facilities as well as the district. Over time, we expect that this will be scaled up to the other districts. We started in 2 districts, Kabarole, and we're also going to move to Hoima. So we are piloting it basically in 2 districts to see how it works and then scale it up to a larger level.
With this project being commissioned by you guests of honor today, we are sure that issues of duplication in as far as data management is concerned will be minimized, and therefore the data that we shall have will be next to being accurate, and therefore decision making will be real. Today we are here to witness and receive 19 computers for health facilities that do not have computers and 10 solar systems. The committee is already in place. Will oversee the utilization of these facilities, and we promise that we shall use these facilities for the purpose for which they have been donated and not anything else outside that.
Today is a very significant day in the fight against HIV/AIDS epidemic in Uganda, because we are witnessing a very useful approach where we will use technology to monitor the prevalence of HIV infection in this district. The approach referred to as case-based HIV and AIDS surveillance was recommended by the World Health Organization in 2006. It will help us track patients and to know whether they access medical care using fingerprint technology. Only a few countries have piloted this technology, and Uganda is one of the first few countries in Africa to do this, including Ethiopia, Kenya, and South Africa. It is therefore a great privilege for the people of Kabarole. You are the first district in Uganda to implement this project. I hope as beneficiaries of this technology, you will use it maximally. I want to commend our implementing partners, the CDC, the Makerere University School of Public Health, and the METS program for supporting government to realize this. With this program, therefore, Kabarole will be able to understand exactly the HIV/AIDS burden, and also to account for the resources and the results of the intervention that goes into the HIV prevention. It's now my honor and pleasure to officially inaugurate the case-based surveillance pilot program in Kabarole and officially hand over the solar equipment and computers for this program for God and my country. My pleasure to hand over what is the solar panel. Solar panel. Come in and you hand over the bed. Yes. Solar panel to the chairman. The solar panels will help you to have power and drive these computers and have stable power to run the test. Hand you over this computer. Wish you the best in running this METS program. Thank you. we'll keep the source of power from the solar panels, and we wish you all the best. Thank you.